Plastic surgery. It seems like a modern invention, doesn't it? When we think of plastic surgery, we often imagine sleek, state-of-the-art clinics, advanced medical equipment, and highly trained surgeons meticulously preparing for complex procedures. It's easy to associate this field with the latest technological advancements in contemporary medical practices. We think of Hollywood stars and cutting-edge technology. The glitz and glamour of Hollywood have certainly popularized plastic surgery, with celebrities often undergoing various procedures to maintain their youthful looks and enhance their features. The media is filled with before and after images, showcasing dramatic transformations that seem almost magical. But the desire to improve our appearance is as old as humanity itself. Throughout history, people from all walks of life have looked into mirrors or reflective surfaces, yearning to see a better version of themselves. This universal desire transcends cultures and eras, highlighting a fundamental aspect of human nature. Believe it or not, plastic surgery has roots stretching back thousands of years. Ancient civilizations documented their medical knowledge in texts and illustrations, some of which included early forms of surgical procedures. These historical records reveal that the quest for physical improvement is not a modern phenomenon, but a timeless pursuit. In ancient India, around 600 BC, surgeons were already performing a procedure remarkably similar to today's rhinoplasty or nose job. Imagine that. These early medical practitioners developed techniques that laid the groundwork for modern plastic surgery, demonstrating an impressive understanding of human anatomy and surgical principles. Using rudimentary tools and techniques, they reconstructed noses using skin grafts taken from the forehead or cheek. This method required precision and skill, as the surgeons had to carefully remove and reattach skin to create a natural-looking nose. Despite the lack of modern anesthesia and sterilization, these early procedures were surprisingly sophisticated.
This procedure, known as the Indian method, was often used to repair noses damaged by punishment or injury. In those times, losing one's nose was not just a physical disfigurement, but also a social stigma. The ability to restore a person's appearance had profound implications for their social standing and self-esteem.
These early pioneers were driven by a fundamental human need to heal, to restore, and to feel whole again. Their work was not merely about aesthetics, it was about restoring dignity and normalcy to those who had suffered disfigurement. The motivations behind these early surgeries were deeply rooted in compassion and the desire to improve the quality of life. It's a testament to human ingenuity that even in those early times, people sought ways to improve their bodies and their lives. The creativity and resourcefulness displayed by these ancient surgeons are truly remarkable. They laid the foundation for a field that would continue to evolve and innovate over the centuries, and it's a story that continues to unfold today, as plastic surgery evolves in ways our ancestors could never have imagined. From reconstructive surgeries that restore function and appearance to cosmetic procedures that enhance beauty, the field of plastic surgery has come a long way. Modern advancements in technology and medical knowledge have expanded the possibilities, making it possible to achieve results that were once thought impossible. The journey of plastic surgery is a fascinating blend of history, science, and the enduring human spirit. The Middle Ages, often seen as a dark age, saw surprisingly advanced medical practices in certain parts of the world. Despite the common perception of this era as one of ignorance and superstition, there were pockets of remarkable medical knowledge and innovation. In Europe, for instance, monasteries often served as centers of medical learning where monks preserved and copied ancient medical texts. These texts, many of which originated from the ancient Greeks and Romans, provided a foundation for medieval medical practices. Arab physicians, for example, made significant contributions to the field of surgery. The Islamic Golden Age, spanning from the 8th to the 14th century, was a period of prolific scientific and medical advancements. Scholars like Al-Zarawi, often referred to as the father of modern surgery, wrote extensive medical encyclopedias that detailed surgical instruments and procedures. These works were later translated into Latin and influenced European medicine for centuries. They developed new techniques for wound healing and skin grafting, laying the groundwork for future advancements in plastic surgery. Al-Zarawi's Kitab al-Tazrif, a 30-volume medical encyclopedia, included detailed descriptions of surgical techniques, including the use of catgut for internal stitching and the application of antiseptics to prevent infection. These practices were revolutionary at the time, and demonstrated a sophisticated understanding of the human body and its healing processes. During the Renaissance, a renewed interest in classical art and anatomy fueled a fascination with the human form. This period, spanning from the 14th to the 17th century, saw a revival of learning based on classical sources. Artists and scientists alike began to study the human body in unprecedented detail, leading to significant advancements in both art and medicine. The works of Leonardo da Vinci, for example, combined artistic skill with scientific inquiry, resulting in some of the most detailed anatomical drawings ever created. Surgeons, inspired by the ideals of beauty depicted in art, began to explore ways to refine and enhance facial features. The Renaissance ideal of human beauty, characterized by symmetry and proportion, influenced not only artists but also medical practitioners. Surgeons sought to apply these principles to their work, leading to the development of new techniques for facial reconstruction and cosmetic surgery. Gaspar Tagliacozzi, an Italian surgeon in the 16th century, became known for his innovative work in reconstructing noses. Tagliacozzi's contributions to the field of plastic surgery were groundbreaking. He authored De Curtorum Chirurgia per Incisionem, a comprehensive text on reconstructive surgery that detailed his methods and techniques. His work was based on the principle of using autologous tissue, or tissue from the patient's own body, to repair defects. Tagliacozzi's method involved using a flap of skin taken from the patient's arm to rebuild the nose. This technique, known as the Italian method, was a significant advancement in the field of reconstructive surgery. The procedure involved creating a skin flap on the upper arm, which was then attached to the nose and left in place for several weeks to allow for vascularization. Once the skin had established a blood supply, it was separated from the arm and shaped to form a new nose. This technique, though crude by today's standards, was revolutionary for its time. It represented a significant leap forward in the understanding of tissue viability and the body's ability to heal and integrate transplanted tissue. Tagliacozzi's work demonstrated that with careful planning and technique, it was possible to achieve functional and aesthetic improvements in patients with severe facial injuries. It demonstrated a growing understanding of tissue transfer and wound healing. The principles established by Tagliacozzi and his contemporaries laid the foundation for modern plastic and reconstructive surgery. Their work showed that the human body had remarkable regenerative capabilities, and that with the right techniques, it was possible to restore both form and function to damaged tissues. His work paved the way for the development of more sophisticated reconstructive techniques in the centuries to come. The advancements made during the Middle Ages and the Renaissance were crucial stepping stones in the evolution of medical science. They set the stage for future innovations and helped to establish the principles that continue to guide surgical practice today. From the preservation of ancient texts to the pioneering work of surgeons like Tagliacozzi, the legacy of these periods is evident in the continued progress of medical science. The 19th century witnessed the formalization of plastic surgery as a distinct medical specialty. During this period, the medical community began to recognize the importance of reconstructive procedures, not just for aesthetic purposes, but for improving the quality of life for patients suffering from various conditions. Surgeons were increasingly documenting their techniques and sharing knowledge through medical journals and textbooks, laying the groundwork for future advancements. Advances in anesthesia and antisepsis made complex surgical procedures safer and more viable. The introduction of ether and chloroform as anesthetics allowed surgeons to perform longer and more intricate operations without causing unbearable pain to the patient. Meanwhile, the development of antiseptic techniques by pioneers like Joseph Lister drastically reduced the risk of infections, which had previously been a major cause of post-operative complications and mortality. Surgeons began to develop specialized instruments and techniques for repairing congenital deformities, traumatic injuries, and the ravages of diseases like cancer. These early innovations included the use of skin grafts to cover wounds and the refinement of surgical tools to allow for more precise and less invasive procedures. The field was slowly but steadily evolving, driven by the needs of patients and the ingenuity of medical practitioners. However, it was the horrors of World War I that truly propelled plastic surgery into the modern era. The war brought about unprecedented levels of destruction and injury, particularly among soldiers on the front lines. The sheer scale of the conflict meant that medical professionals were faced with challenges they had never encountered before, necessitating rapid advancements in surgical techniques and patient care. The unprecedented scale of battlefield injuries, particularly facial disfigurements, created an urgent need for reconstructive solutions. Soldiers returning from the front with severe facial injuries were often unrecognizable, and the psychological impact of these disfigurements was profound. The medical community had to find ways to not only restore physical function, but also to help these men reintegrate into society and regain their sense of identity. Surgeons like Harold Gillies, a New Zealand-born doctor working in Britain, pioneered groundbreaking techniques to rebuild shattered faces and jaws. Gillies' work was revolutionary. He approached each case with a combination of scientific rigor and artistic sensibility, understanding that the goal was not just to repair, but to restore. His methods included the use of pedicle flaps, where a section of skin and tissue was partially detached and then moved to cover a wound, allowing for better blood supply and healing. Gillies is often hailed as the father of modern plastic surgery. His contributions went beyond the operating room. He was instrumental in establishing protocols and training programs that would ensure the continued development of the field. His legacy is not just in the techniques he developed, but in the countless surgeons he mentored and inspired, who would go on to make their own contributions to the field. He established specialized hospitals dedicated to treating facial injuries and developed innovative procedures for skin grafting, bone grafting, and flap surgery. These hospitals became centers of excellence, attracting patients from all over the world and serving as training grounds for the next generation of plastic surgeons. The techniques developed in these institutions would form the basis of modern reconstructive surgery, influencing practices in both civilian and military medicine. His work not only restored the physical appearance of countless soldiers, but also helped to heal their psychological scars. The impact of facial reconstruction went beyond the individual. It had a ripple effect on families and communities, helping to restore a sense of normalcy and hope in the aftermath of the war. The success stories of these surgeries were widely publicized, changing public perceptions of what was possible in the field of medicine. The war, as tragic as it was, became a crucible for innovation, pushing the boundaries of what was surgically possible and laying the foundation for the field we know today. The lessons learned and the techniques developed during this period would go on to benefit countless individuals in the years to come, proving that even in the darkest times, human ingenuity and compassion can lead to remarkable advancements. After World War II, plastic surgery continued to evolve at a rapid pace. Techniques refined on the battlefields found new applications in civilian life. Surgeons, now equipped with a better understanding of tissue healing and reconstruction, turned their attention to addressing a wider range of concerns. The post-war era saw a surge in demand for procedures like breast augmentation, rhinoplasty, and facelifts. This shift towards aesthetic or cosmetic surgery marked a turning point in the field. No longer solely focused on reconstruction, plastic surgery began to embrace the concept of enhancing appearance and boosting self-confidence.
This period also saw the development of new materials and technologies, such as silicone implants for breast augmentation. These innovations further expanded the possibilities of plastic surgery, offering patients more options and more natural-looking results.
The stage was set for the cosmetic surgery boom that would define the latter half of the 20th century.